Dr. Sri Shamasundar has been practicing emergency medicine from the back of a car.
How's your breathing?
That's good.
But there are limits to what this team can do.
So EMS has just showed up because the gentleman is telling the folks here at COPE and Dr. Sri that he's got shortness of breath, asthma.
And COVID-19 is surging through the Navajo community, suffering one of the highest infection rates per capita in the country. The peak weeks away. Dr. Shamasundar is the co-founder of the Health Initiative at UCSF. He's teaming up with locals like the COPE program's Nitumagabo Champaign. They're doing rounds at this motel in Gallup, New Mexico, where the unsheltered and the sick can go to get off the street and away from extended families.
So mostly the headaches bothering you?
Yeah.
No, any blurry vision?
No.
Historically, the U.S. government hasn't helped much, breaking dozens of promises with Native American tribes, and Congress has approved $8 billion for tribal assistance, but that money has to be split amongst 574 tribes. But Navajo President Jonathan Ez says receiving those funds is complicated.
Sometimes it goes through the federal agencies before it gets to the tribe, or it goes through the state before it gets to the tribe. We're using that same process, and we have to wait, and we have to submit for these fundings. But the need is now.
It's estimated that about 30% of the people who live on the Navajo reservation do not have access to running water, which is why they use pumps like this. And that makes the constant hand washing necessary during a COVID outbreak that much more difficult.
Since early March, grassroots groups have worked to provide food and water. The Navajo and Hopi family COVID-19 relief effort raising over $1 million, setting up this makeshift hand-washing station and distributing it around the reservation.
It's just one fix to address the hygiene issue. Don't wait until people are sick, because the conditions that are making people more sick and more at risk are right out on the street.
The Navajo reservation is larger than West Virginia, but its population of about 300,000 has access to only about 20 ICU beds. The Indian Health Service says they've had to build additional temporary hospital beds to prepare for a modeling prediction of over 200 additional patients a day and over 100 ICU-level patients across the area. In the vastness of the reservation under the shadow of Chimney Butte is where Michelle Tom grew up.
Actually, you can see where I'm from.
Also without running water or power. She's now the only Navajo emergency physician at this urgent care clinic in Winslow, Arizona.
You're getting people pulling up to this parking lot. They have to be intubated here, even though this is not technically an ICU or a hospital, it's an urgent care. Yes.
She says the closest ICU facility where she can send her patients is at least 1 hour away by chopper or up to 3 hours in an ambulance. Of course, it's no longer a hospital. And growing up, Tom says she never saw a medical professional with a face like her own.
I never saw a Native American as a nurse or a doctor. Sometimes there's a disconnect when language and cultures are not meeting. We know that just by studies and even by experience, you're not going to have the best health care.
She left her family and moved to an apartment an hour away to try to minimize the risk of infecting the group of people she's trying to save.
My job is immensely hard because I have such a connection to my people and to my land. Our elders, our teachers, our protectors, they hold all of the key elements that we need to have a strong sense of identity.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.